All right, everybody, welcome back to a special episode. Probably the most special episode we've ever done. Wouldn't you say, Craig?
Oh yeah, muy
This
especial,
this
muy
is
especial.
the Bulletproof Dental Practice podcast. And tonight we are graced by our two unicorns, the ones, the onlys, Bulletproof Hygiene Gals, Charissa
Hi.
and Brittany.
Hello. Thank you
Hi
for
there.
having us. We're excited to be here.
Yes, thanks so much.
Yes. So if you are listening at home, you might want to get your pen and paper. If you're a doc and you want to take notes for your hygienist, feel free, because this one's going to blow your doors off. And they're going to teach us. They're going to teach us all their tips and tricks, and then their paradigm shifts and everything in between. Right, gals?
Yes, 30
Right.
years of cumulative
In 1
learning,
hour.
and then next in under an hour.
Right.
Gift hygiene.
Jam-packed.
We're just going to pick your brain, right?
Okay.
Don't you love when people say that?
Yeah, for
We did a
sure.
podcast on that, actually.
Yeah. I know.
Anyway, y'all, we're really excited to have you. You know, all jokes aside, you guys are beacons in the industry and definitely in our own respective practices. Charissa works at at Atlanta Dental Spa and is the hygiene lead there. If you scroll back all the way before Craig was even part of the Bulletproof Dental Practice podcast, I did a podcast with Charissa, and I said it's the 500K hygienist. And Charissa, that's gotten a lot of views.
Oh,
And
yeah?
since then, Charissa has grown with Atlanta Dental Spa and continued to lead all the hygienists in our ecosystem. But as of last year, she and Brittany had a Bulletproof Hygiene breakout from our summit in Houston. And so now, because it was such a great success, this year coming up, you guys have your own like 8,000 foot ballroom in the one we're doing in
Woohoo.
Austin.
Yeah.
So,
Woohoo.
Awesome.
Craig, do you want to say a few things about Brittany?
Yeah, so Brittany is our lead hygienist at SDG, and she befriended Charissa a long time ago. How many years ago was it that you and Charissa got together?
2018.
Okay, so that's a long time ago in my world. And spent the day with the $500,000 hygienist and picked her brain, and they became friends. And Brittany has led our department, year over year growth of, 20, 30% consistently. And it's an honor to have you here, Brittany. When we brought them to our last summit in Houston,
It was
right
just a
before
test,
COVID.
wasn't it, Craig?
It was a test. It was
a
a test.
test.
We're like, hey, let's see how you guys do. And it was a sink or swim, and they flew. So
And the
from
feedback
that,
from the people in the room, we gave you guys like a giant coat closet to teach in, and
wasn't
the
a giant
feedback.
closet.
Well, this was
Exactly what it
this was pre-COVID, so it was okay to be on top of each other, right? So I mean,
Right.
now
Yeah.
that would be heaven forbid.
that would have been a super spreader for sure.
That
It
would have been a
literally
super
70
spreader
bodies.
event.
It was a fire hazard, actually. It was a fire hazard.
Probably
Yes.
so.
So they literally, you crushed it. The feedback was incredible. It was supposed to go on for like 2 or 3 hours. We didn't see the hygienist for like 7 hours. Everybody ran out of note paper, and it was just inspiring to watch the two of you bring such light and energy to the hygiene world, because I think there's a decent amount of inspirational dental educators out there. And I just think that there's a lot of open space for the hygiene segment, people that are actually doing it. I know there's a lot of academic hygienists, and there's a lot of people that are sponsored by different companies. But for two gals that are actually wet fingered doing it, producing like levels of production and collection that's up at most dental offices, it's inspiring. So I'm honored to have you guys. I think I'm honored to be a part of it, because I think hygiene and dentistry needs this. And this is really the inaugural episode of a very big program we're launching. This
So
is
tell
really
us
cool.
tell us what you guys have been working on since that. So we've set that up, and so it's been a little bit of a whirlwind since Houston Summit, and you guys. So tell us what you've been up to since then.
So first I want to say thanks to both of you for kind of leading the way too, and giving us the opportunity to have this partnership, and for having us on the podcast. We appreciate your leadership, like from the bottom of our hearts, so much. So thank you. for being the leaders in our practices, the leaders for Charissa and I. We learn from you guys every day. So thanks for kind of going before us and doing everything and, doing the hard work and laying the foundation, like a firm foundation for us. And I feel like that's one of the reasons that we were really able to kick butt, is because you guys kind of set us up for success, other than the closet room on accident, but everything else was so we appreciate you guys. And Charissa, do you want to start? Do you want to tell them what we've been up to?
Sure, I'd love to. And my sentiments, I agree with Brittany entirely. I think one of the reasons we are who we are is because we've had empowering dentists behind us that have really given us the autonomy to be who we are and grow where we need to grow, and supported that. And that's really, really been beneficial in our careers. And so, yeah, you're right. We kind of jumped in the water in Houston and weren't really sure how this was going to go. I mean, we've been friends, but we haven't ever taught together. And so we developed material together and went out and just said, let's see how this goes. And it went better than I think we expected. And so we came back from that and we're like, where are we going from here? And then COVID hit. And because we had 2 months of sitting at home doing nothing, I mean, Brittany and I became best of friends because we decided to write a book during that time. And so we put together kind of everything that has occurred to us over our years of experience, the wins, the losses, what's working, what's not, what we see is really important, and really how to help other hygienists be their best selves so that they can help their patients be as healthy as possible and their practices be successful as possible. So we spent a lot of time really thinking and writing and editing and getting it all put together, and then thought, well, gosh, this book is awesome and great, but there's even more we want to talk about. So then we created a whole lot of video content that will actually kind of partner along with the book as online video training. So that's kind of been the next step that we've taken.
Yep. And it's really been a hand-in-hand kind of initiative thing that I think has been really cool, because like you said, the book we started and kind of laid our foundation, and then I feel like the mastery videos are a lot more specific. They get to the nitty-gritty, they get to the operational, the how we, make things work from the ground up kind of thing. So I think it's a lot more specific and helps with all the groundwork and laying the groundwork for what Charissa and I do every day. So we've had a really great time, though. I've had a great time collaborating with Charissa. She's such a wealth of knowledge and she's such a great person, fun to be around. So we had a great time.
Yeah. And I think the two of us, we were talking about this earlier. I feel like we are a really good balance for each other. Where I'm strong, Brittany's weak, where she's strong, I'm weak. Like, we're really good complementary. We have different experiences that really go together well. So I think we cover a large gamut of hygiene issues and tricks.
So I got a question for both of you. So obviously you guys went from being maybe average, above average hygienist at some point in your career to being super hygienist. What was the paradigm shift? What was the click that you all of a sudden 2x'd and became something that you just, all of a sudden now you saw, what am I trying to say? You saw the entire mouth, like something clicked where you became, let's say you were doing a hygienist doing average collections, right? So I think, Craig, what's probably an average collection for a hygienist, would you say, in the United States?
I think on a yearly basis,
180 to 220, maybe. Brittany's shaking her head.
200.
So what was the shift for you guys? Like, what did you learn? What was the mindset? Was it something that you learned clinically? Was it something that you learned from a mindset? How did you guys all of a sudden catapult to going next level? Do you remember that inflection point that you had that changed the game? You do. Charissa's shaking her head. Charissa, go. Let me hear your story.
Very specifically for me, I had been practicing for about 13 years in the same practice, and it was a good job and I enjoyed it and I loved my patients. And then life necessitated
This was pre-me, right?
This was pre-you, because life necessitated, thanks for clarifying.
Yeah, I just making sure.
I needed to pick up an extra day of hygiene. And so I started looking around and, saw Atlanta Dental Spa needed a hygienist the same day I was looking. And I thought, all right, well, let's give that a go. And so when I stepped in the doors there, it was a different practice from a standpoint of, the practice I had been at, we did the same CE every year. I never really learned anything new or different. I was never stretched. We didn't do a whole lot of new technology. And so when I stepped into ADS, all of a sudden you guys were so big on new CE and learning the new and staying current. And so that was very different for me. And one of the meetings we went to, they started really talking about this oral systemic connection. And that was intriguing to me. And then I know we ended up kind of
you and I were in the founding
That's what I was going to
room.
say. Yeah, we ended up, up in Madison, Wisconsin.
Craig, I was a founding member of AOS. Did you know that?
Oh my God, that is amazing.
Oh, thank you, buddy. Thank you. Charissa and I both were.
That's right.
I know, it's a big deal. It's a really big deal.
Thank you.
But that's literally what set me on fire, was when I understood that what I did on the day in and day out was more than just cleaning somebody's teeth. I wasn't a tooth janitor. I was like a life supporter, like a lifesaver. Like, what I did in their mouth is going to determine, I can drop their A1C by getting their perio stable, or if they've got an arthritis flare up, if we can get that inflammation in their mouth calmed down, they're going to feel better and function better. We're preventing heart attack, stroke when we're addressing these things. So I couldn't unsee what I saw, and it became a good job. It turned into just an absolute passion. So that was the big shift for me.
So okay, go ahead. I'm sorry. I want to make sure that every dentist that's listening to this, because I imagine a lot of dentists and hygienists are going to listen to this. And I want to make sure we touch upon something about dentists that are getting ready to roll their eyes right now, because there's so much discord going on that there's so many things I want to hit on, but I want to hear the defining moment. I'll elaborate. I want to put a small pin in it. Britt, what was your eye-opening moment, if as Peter was saying?
So I had a couple of aha moments. I graduated in 2012. So I feel like when I graduated, there was a lot of our curriculum was about the oral systemic link. I think that wasn't the case as much leading up to that point. So I got a lot of that, fortunately, in school. And I was really, really passionate about oral systemic, like everything. I thought that was also what set me on fire, but I got it, I think, at an earlier point in my career because of the way that education has been changing, thankfully, right? According to new research and evidence-based care. So I got a lot of that in school. What was really disheartening for me is after I graduated, I did some temping to find out initially where I wanted to work and kind of what kind of setting that I wanted to be in. And I got a lot of pushback from the docs over my assessment, and not because my assessment wasn't accurate, but because a lot of the doctors that I interacted with and experienced at that point in time were either driven by insurance, letting insurance like drive the bus, and like, oh no, Mrs. Jones can't have the scaling that she needs because her insurance is only going to cover a crown. And a lot of them, unfortunately, were kind of dictating treatment in that way for the patients instead of giving them the best options, letting them choose, make an educated decision for themselves. So that was very disheartening. I found a full-time job where I, got 45 minutes per patient. I'd flip my own rooms. I did my own perio charting. I kind of walked into it, and it was an interesting experience because, medical histories weren't up to date. Patients weren't being perio charted. So I was walking in and kind of like starting fresh with every patient. So that was kind of a learning opportunity for me, where I got to learn how to take a practice basically from a hygiene practice, like take over a hygiene practice from the ground up and kind of start educating. And I felt like at that point in my career, what do I have to lose? I'm going to educate these patients. I'm going to have open conversations with the doctor, see where things go. And, patients were accepting the treatment that I was recommending. And so the doctor really jumped on board, to be honest, at that point. That was my first full-time experience. And it was a good experience, it was a learning experience, but I didn't really, it was all worth it. It was all the foundation for what happened next. But I ended up joining Spodak about 2 years into my career. And that's where I really had some opportunity to be the best hygienist that I can be, because Spodak has given me the best resources available. So I have the best technology available, but also the culture and the growth and learning mindset like paints the picture and sets the tone for mistakes to be made, for creativity. And honestly, Dr. Craig, like you have said so many times, I'm a person who operates with a lot of autonomy. Like, I feel like the more freedom you give me, the better I'm going to perform and do. So the more you kind of said, hey, Britt, here's a little thing, I trust your judgment, go ahead and do that, and then I did it departmentally or just in regards to hygiene, something or other. And I said, okay, and kind of ran with it. The more you did that for me personally, and I think this goes for a lot of hygienists, the more I felt empowered to continue doing that. So as the docs came in and backed up my treatment plans, as you said, hey, here's a little bit of power, run with it, do what you're going to do. And then it was successful, or the outcome was ideal. I think that really jumping on board with Spodak, getting the resources, getting with docs who are thinking like, I want to be a part of this team. I want to be engaged. I want to formulate treatment plans with you. You're not just a tooth janitor, and being in an environment where that's possible. And we're here collaborating like that on a daily basis. That was kind of a big turning point for me. And then also visiting Charissa, later on in my career, I feel like, first of all, I've only been practicing for 8 years, but I feel like I've been on the fast track, and I'm so incredibly thankful for having been on the fast track, being at Spodak Dental Group, having had the mentors that I've had, running into Charissa, you guys organized that meeting. So I'm always going to be thankful for that. Ashley and I flew up. Ashley's one of our hygienists here at Spodak. She's incredible. She's been here for several years now. But she and I flew up when we heard about Dr. Boulden's unicorn hygienist producing $500,000 a year. And we were like, what is she doing? Extractions? Like, line? Like, this lady, what's happening? We went up and we were like pleasantly surprised, but a little bit like smacked in the face, because we're like, we suck. We're the worst hygienists. Like, this lady's totally ethical and she's awesome. And she's like beautiful, and her patients love her, and the rapport and the verbiage, and we were just like so wowed by Charissa. We both learned so much from you, Charissa, and I know that you know this. I told you like so many times.
Yes.
But just, it's cool to get out of your own space and see what's possible. And that's really what Charissa and I want to do with our book and our videos and our podcast, just like open up this different space and this different way of thinking, I think.
I think you nailed it right there, Britta. And that's kind of the beauty of Craig and my relationship, is that, he pushes on me in areas where I'm like, whoa, I didn't even think about that, because that's not the way my brain thinks. And when I went to Spodak Dental and kind of observed, there were things that I took away that I was like, oh, this would be a great fit. And I'll just steal it for ADS, and you guys have done vice versa. And, look, there's nothing new under the sun, but I think, being committed to growth and dropping your ego like you did when you came up and saying, hey, I'm here to learn. And Charissa, you doing the same, even though Brittany, has not been in the game, has only been out 8 years, you picked up, I know, because you've told me tips and tricks, things that you've applied. Right. So I think that's where the magic happens, when you can have two people who are different yet equally successful, and then authentically share in a collaborative environment. That's when the magic happens, I think, right? When you both want each other to authentically win. Right. That's when it's awesome. So, Craig, I'm still haunted by this Discord thing you said.
Yeah. So here's what's going right in hygiene. The last, minutes that we've been on this podcast, what's going right. But I'm hearing in my head, the dentist that I see and listen to on Facebook, there is this idea, and I see it a lot. I spend a lot of time like just kind of perusing and, watching what's the chat that's going down on most dental chat rooms. And it's this dialogue of the hygienist is a prima donna. My hygienist doesn't want to come back after COVID. They want raises. They want hazard pay. You know what? Screw the hygienist. It's a lost leader. It doesn't work. They're prima donnas. Hygienist is not profitable. And it just breaks my heart, because, we know so different. And the hygiene is the superpower. I don't remember the exact word that we used, Peter, but we look at hygiene as the engine that drives the practice. It's who the patient has a relationship with. It's MVP, the reason we said, right? Yeah, the MVP, exactly. Thank you for that. And I got a lot of comments from that, like, oh, I don't know where you're finding your hygienist from. And it just breaks my heart, because it's almost like it's a car that has no wheels. If you really want to have a bulletproof dental practice, you want to have a high performing practice, you have to come to understand the critical role that hygiene plays, and giving your hygienist some degree of autonomy or hiring the right people that are business owner mindset and things like that to really get this thing running. Because what we do as dentists, and oftentimes, is we disempower them, 100 times a day. Hygienists see an area of concern. They call the doctor over. They spent a couple minutes talking with the patient about it. Doctor comes over like, that's not it. What are you talking about? That's fine. Leave that alone. We don't need to treat that. We don't need to watch that. And then little by little, it's like a death of 1,000 cuts. So your hygienist the next time like says in a different way, hey, Dr. Jones, I'm kind of concerned about, don't be concerned. What dental school did you go to? Mm-hmm. And like eventually, after months or weeks or years of that, you have a hygiene department that's completely like, screw it. He's not going to tell me anyway. He's actually going to tell me instead of 8 patients a day, he wants me to do 20 now. And that we don't need to do 45-minute pro fees. We should be doing 25-minute pro fees. And it's really caustic. And I think if we're doing our job right as Bulletproof Dental, Bulletproof Hygiene, we shift the consciousness of the dental profession to understand, get an empowered hygienist, and get the dentist to understand the power of the empowered hygienist and have them work through their bullshit and get it going positively. So that's what I'm excited about, because I see that, you know, there's a bunch of hygienists, you know, thousands of hygienists are going to go to see Brittany and Charissa, and they're not going to get anywhere because they're going to come back all excited. And let's face it, Peter, most dentists, for better or for worse, are not you and I. We're not thinking this way. We're not entrepreneurial. There's not a lot of room for this. So I want to dive right into that. How do we get this? How do we, if our mission is to elevate the profession in that regard, what are the things that the dentist that's listened thus far needs to start understanding?
Go ahead, Dr. Boulden.
Well, you know, as I hear you talk, I mean, do you guys agree with this? I mean, from your colleagues, do you agree that do you agree that there's discord or conflict in an operatory? You do
Yes,
hear that? Okay.
absolutely.
Not some.
Yes.
Correct me if I'm wrong, but I think it's quite common, unfortunately.
I think
So
it's
just tell me.
widespread.
Yes.
Really?
I think it's widespread, and I'm going from a lot of the social forums. Like I know that those are like primarily negative because people are airing their bad feelings.
Why would you think that? I want to hear, Greg, I want to hear what they have to say. Why would y'all think that that would be a pervasive problem?
You want to hear from us?
Yes.
Okay. I think there are a couple of issues, and one of the issues is what Dr. Craig said about, assessment and dentists kind of like coming in and minimizing the assessment or the findings of the hygienist, because we do, leave school like with all of these like ideas and aspirations and kind of like really get the training that we need to be successful in the real world. But then we get out and we do this assessment, an adequate assessment. We take the radiographs, we do the comp perio chart, we take photographs, we educate the patient. If the dentist then comes in and pulls the rug out from under our feet and says like, oh no, none of that's concerning, or no, we're not going to treat that because insurance this, that, like you're teaching your hygienist, you're teaching us that our assessment isn't valuable, or teaching us that we're wasting time.
Yeah, that's bad.
And you're teaching us a lesson.
Charissa, would you agree?
And hygienists are smart, so we're going to learn quickly that it's not worth spending the time to do all this. Like,
well,
it's not
I mean, smart or unsmart, like meaning like, I mean, Pavlov's dogs learned that, like, meaning I'm not trying to say, like, I'm saying you don't have to be smart to understand, like, hey, that didn't work out well for me. Let's not do that again, because all I did was get humiliated in that experiment.
Yes.
And I ran behind. So not only that, but now I'm running behind. I got to know more. What's your
thoughts on that?
I absolutely agree with all of this. And I don't know all the regulations countrywide about, I know in Georgia, like, we are entirely dependent on the dentist coming in and making all the calls, So what we say and what we do is constantly being overseen. And, our voice seems smaller once the doctor walks in the room. I know a lot of hygienists talk about, they'll go to some CE, they'll go, see some new products, they come back, they're all excited, they're talking about it, and their doctor just shuts them down right away. And so it becomes this, oh, well, I go do CE because I'm required to do that, but I'm not going to get excited about it. I'm not going to really learn anything new because I'm not going to be able to go back and use it. And I mean, I've literally heard those words from other hygienists.
One thing I think
and on top of it, by the way, there's this dialogue like hygienist is not allowed to diagnose, or by state law, you can't diagnose. So does that automatically mean that if your hygienist sees an area of concern, that she should not bring it up? Because we have the opposite, Peter and I. We meet hygienists, and we've met them. Now I don't do the hiring. Brittany is the person that would ascertain those skills. But I remember originally like doing working interviews in case and clinical assessment days. And I would say, well, did you see any concerning? Well, it's really not my job. I'm not supposed to bring up anything concerning.
It's unfortunate. It's unfortunate that this is a problem that you guys hear. Honestly, I'm in my own echo chambers, Craig. So I just thought that I didn't know that kind of was going on because I don't talk to hygienists about it. But it's unfortunate that goes on, because honestly, like, that's the last thing a dentist wants. It's the last thing a hygienist wants. A dentist is getting up from doing his crown prep to go in and run. The last thing they want is a hygiene check that has friction in it, right? And so what I think the downfall is that, and I hate this word, role play, but I think that a lot of offices, they just get into the game and they haven't practiced and they haven't done role playing and saying, hey, what would you do in this scenario? Because Charissa, there have been many times when I've done a check on you and you and I have not agreed, but guess what? Guess who couldn't tell the difference?
The patient.
The patient, right? So we waited. We are on stage. And Craig, I'll never forget when you introduced me to the book and you had that conversation, what would Disney do? So the patient satisfaction, the patient experience is predicated on how well the doctor and the hygienist get along. The time to have discord is not in front of the patient.
Right.
And by the way, that's not heavy duty acting. It's, hey, Charissa, I totally see why that concerns you.
It's verbiage,
and thanks for bringing that up, because that's the type of thing I need you to be looking for. So thank you. And,
right, but Craig, but most people can't think on the fly like that, right?
Yeah.
So because all they get is rattled by the fact that, did my hygienist just diagnose? It's like, oh, that was awesome. Yeah, thanks for that suggestion. That, you know what, I will keep an eye on that. But for right now, I'm more concerned with number 3 or something, right? There's way to flex your academic prowess as a dentist, if you will, without belittling the hygienist and without destroying the experience of the patient, who is the monkey in the middle of feeling super sweaty back awkward now.
Mom and dad are fighting.
Right? Like, this is weird. I'm finding a new practice because this is weird. And honestly, you guys, let me tell you something. If you're dentist listening and you are at all a little bit rude to your hygienist, patients are going to get pissed, because I promise you, they probably like that hygienist more than they like you. Maybe.
Well, they know her name and they know everything about her.
Well, they had, like they're more of a relationship. They spend more time, like they see them on a regular basis, right? And again, I don't want to get hate mail on that. I'm just saying, like, I wouldn't want to go toe to toe with seeing who Charissa's patients like her or me with that.
I want to say too. Oh, go ahead, Britt.
No, well, we're co-diagnosticians, so like, hygienists are licensed healthcare providers, and so are dentists, and we're working under the umbrella of the dentist license, right? So at the end of the day, no, I can't move forward if Dr. Craig disagrees with me and says, no, that's not the right treatment for Mrs. Jones right now. But if, just back to the reinforcing point, like if you're training me that my assessment isn't going to be validated or it's not going to be reinforced, you're not going to tell me that was worth my time, then we're going to stop doing it, kind of thing. I don't know if you guys want to get into, Charissa, do you want to share a little bit?
I guess, Brittany, what I want to drive home is there's no practicing going out at all. Meaning the only time we're actually having that dialogue is actually when it's live in the game of a patient being there. I don't hear people saying, hey, let's run this scenario. Let's role play this. Let's practice our, trust transfers. Let's do all these things, right? And these are benefiting these. And honestly, when you do that, it makes the game, quote unquote, much less friction, has much less friction. Yeah. Your appointments go in, you enroll treatment from your hygiene check that only took 5 minutes. It was very comprehensive, and you're back to your crown prep. Instead, you walked in, you came in, you squawked, you shit on everyone, and then you left. And then everyone feels like, what the hell is that?
Yeah, what the hell just happened?
Well, and I think that, yes, you're right. You need to practice, you need to learn the skills, you need to practice. But I think before even that comes the mindset.
Okay.
Because how many dentists do you know? And we as hygienists have felt this 1,000 times, where you go to your dentist, you need an exam, and you feel like you're bothering them. You feel like the dentist thinks, oh God, I'm in the middle of doing work. I got to get up and go check this hygiene exam. And especially like Craig said, if they don't view hygiene, if they view their hygiene department as a loss leader, then to them, that's just a nuisance. And you feel that as a hygienist.
Well, and that's just part of the game, right? Like, honestly, let's be real. Sometimes it is a pain in the ass because you're in flow, you're in that zone. You're like, oh, I'm like feeling magic. Then all of a sudden you feel a tap on your shoulder, and you're breaking us out of an artistic creation, right? We're sometimes in this flow, and it's hard to describe. And so, yes, it is hard to say, okay, let me shake that. And now let me go in and be, it's hard.
Yeah,
it is hard.
Turn on the personality for 30
yeah,
seconds.
it's hard to like go from, let me put this hat on now. So
right.
I do.
But we understand that as hygienists too. We understand when we're going to get you that, we don't like interrupting either. We don't like being interrupted. Like, we totally get that. But at the same thing, we're at your mercy. We got to have that happen. So I think the mentality, you've got to embrace the mentality of your hygiene department can be a Rockstar department. You've got to give them the autonomy. You've got to do the practice. You've got to have all the role play, because here's the thing. Say you get interrupted and you go down the hall and you do the exam, but because you've perfected your communication and your technique, you bobblehead what your hygienist just said they needed, and then you're back to doing what you need to do. And everybody felt empowered. Everybody felt respected. So it's a whole program of getting everybody where they need to be, but there's a lot of steps. And I think, I feel like it's easy.
It's all the magic that you practice and intensely. work on, and the relationship and the respect that makes the magic. Like in our practice, in any given moment, on any given day, rather, I am asked by several hygienists, hey, can you come in and meet a patient in Op 5? They are ready to go for Invisalign. I've told them everything. They know the money. They're ready to go. I just need you to put your eyes on them. That's what the conversation is. I'm like, oh, okay. And I walk in, and the outcome simulator has been done, and financing has been talked about, and everything's wrapped up and done. But that is the magic. That's the final step. That's the champagne moment of all the work that we've done. And everybody else is like, oh, well, my hygienist, because I live in Spokane, they don't do that here. And you hear that so much, and that's such bullshit.
Yeah.
And I think it just comes down from what Charissa was saying, having the understanding and the belief. People feel what you believe. So if you really freaking hate your hygienist, you really feel like they're a pain in the ass and that they're overpaid and they shouldn't be, and they're always asking for more and more and more, then maybe they're going to feel that. And I think also when you get into like a lot of the dialogues about money, like, oh, hygienists here want so much money. I'm like, well, geez, I mean, if they can produce, you can't say that $30, $40, $50, $60 an hour is too much. You could have a hygienist that makes $50 an hour, and she could be the biggest win for the practice ever. And you could have someone that's $26 an hour, and she could be bleeding the practice dry. Mm-hmm. So people bring different value to the hour. And I think a lot of it is from this idea that I think from the hygienist side, I'm speaking about what the doctor's misunderstanding
from a loss leader perspective. You're thinking,
yeah. And now let's go to the hygienist side. They think like, oh, well, there's no overhead, and I'm bringing all the stuff, and so it's caustic on both ends. So we got a lot of work to do here in this whole thing.
I agree. Sorry, I just wanted to say, like, when the dentist has the opportunity to like be in the zone and has that restorative, like productive appointment, a lot of that comes from hygiene though. So I think it's important to keep that in mind. If all this stuff is perfected, like the dentist is able to do a full mouth rehab or able to.
No, of course. Trust me, that's not lost on us. I'm just saying, like, when you get in the flow.
I know it's not lost on you, but I think that it can get lost in the hustle and bustle of like every single day. The hygiene checks are why your schedule's filled next week. So I think that's
100%.
And we noticed that, by the way. So we've seen number of periodic exams in our practice because we haven't always had willing doctors that will jump up when the periodic exam is needed. And we have a multi-doctor practice. So sometimes hygienists will go to the people who always say yes. But we've seen number of periodic exams and production directly proportional to each other. So like, we're fascinated. We the enigma and the admiration of the new patient. We're so excited about it. When we know out of the hygiene room after Charissa or Brittany or our hygienist has spent 45 minutes talking about their treatment, the case acceptance is through the roof. But yet we're going to run over it for that new patient who we don't even know. And we think that's all the beauty and all the glory lies in the new patient. It's just not true. So the patient that's in your chair is the one you need to focus on. And that's another thing as well.
Well, I think too, Brittany, you bring up a good point that sometimes Craig, you said the loss leader, right? And if you not run the straight up numbers of what the hygienist collects versus what they're paid, sometimes dentists get grumpy pants when they look at a P&L and say, God, this doesn't work. But they forget the ancillary benefit of, wow, because honestly, we have hygienists that maybe are not producing like Charissa, but guess what? They're putting a ton of restorative on the books, and that's equally as valuable to the ecosystem, to the practice, right? And so,
but I think you'll wind up having it all. I just
of
think
course that's the
department.
That's the triple threat.
If they're producing well, it's because they're talking whole mouth, whole body. And just because SRP Paraprotect doesn't fit or whatever they sell on their shelf, their therapeutic things that they sell, it opens up the conversation to malocclusion, to mouth breathing, to sleep apnea. So you can't have one without the other. If you have a highly productive hygienist who's ethical and well-educated, he can't help themselves from selling big cases of dentistry because the questions are being asked.
As long as you have our backs. Yeah, as long as you come in and totally like slam dunk it for us, like you said, like I feel like, and I think this is true across the table, like we're willing to do the work. The work doesn't scare us as long as it's like, I can trust Dr. Craig to come in after me, after I've spent all this time educating the patient. They already believe me, and you just
say, not shit the bed.
Yes.
Exactly. Not
like,
unsell
yes,
it.
please,
Just don't. All you have to do is don't unsell the treatment that I've already enrolled. Yeah. Just don't unsell it.
Anything, just come in.
They're ready to go for Invisalign.
Sign it. No, I'm just kidding.
Okay. Well,
yeah, but it is a cycle. I think it all is intertwined.
All right. So Greg, keep going with your thought process here.
Well, so I think that's the one thing. So just having a hygiene department that really, cares about the long-term, the best treatment and dedicates to the right thing and constantly pursuing education, growth mindset, wanting to take on new skills. But also one of the wild cards is I believe that compensation drives behavior as well. And I do believe that there are dedicated people. We're all dedicated. We all do the right thing. But if you have a certain unit of time that's allocated for your procedure, imagine if every dentist could only do 1 hour appointments for a second. So imagine if every dentist, let's say socialized medicine takes over and the United States Health Department says all dentists can see one patient for 1 hour. You have to see 8 patients a day, 1 hour. What would your dentistry look like? It would be different. It would be really different. Because you have to treat to time constraints.
Be functional.
But one of the things, I'm sorry?
Be functional.
Well, what we've done is our hygiene department runs on, we want to take the very best care of a patient. And that could mean that you have to take control of your schedule. So Brittany may just decide to come in on a day off for 2 patients or 3 patients, or recognize this patient needs really a lot of, we have handicapped patients who can't get out of wheelchairs, and they may want to take an hour and a half or 2 hours with them and pull in a hygiene assistant and all that stuff. And we have the hygiene department thinking like a business owner saying, what do you think the right thing to do is? Mm-hmm. So if you just spend 3 hours on a patient, to do a prophy, should it be $70, $80? We have to think about this stuff. We also, and you have to allow your team to make the mistakes, because if they get in trouble early on, if they come to you, if you have a bright, new team member, they come to you with an idea and you squash it, it will take you weeks, if not months, if not forever, to rebuild the confidence to do that. And the same thing with finances too. So we'll have conversations about I've told Brittany hey, this guy, Gus wants to come in and he wants a cleaning and we're booked up for 6 weeks, and you want to accommodate him, and she'll have a business conversation. I can come in on a Friday if you need me to, and I can do that, and it's going to be blah 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 blah. And he's like, yeah, that's fine. I'm not worried about that. I'm not worried about that. I'll have you come in for that. Oh, and can you do white and can you stay later? Yeah, I can do that too. So it just creates a more fluid, autonomous business environment for them to have. I mean, and we're talking obviously fee for service, out of network type patients, but there's things you can do as well in insurance environments.
So sure, you guys both train others and lead other hygienists. Where have you seen the biggest change where a hygienist was stuck and all of a sudden you made a breakthrough with them and they saw the forest from the tree, and all of a sudden now it was a different hygienist? Where have you seen that being the case?
For me,
yes.
I do the hygienist quarterly reviews, and I do some hiring and onboarding and things. And it was one of our quarterly reviews where we, review feedback from the doctors, review qualitative and quantitative goals. We kind of see where we are for the year, and how we're going to proceed and move forward and meet and exceed goals. So I was having a review with Ashley, and she's giving me permission to share this story. She was having a real hard time with presenting PerioProtect, and it's because she had this belief about selling in her head. She had this feeling about quote unquote selling and being sold something, and she had a belief about money and what's a lot of money and is it a lot to me, and kind of projecting those things and her beliefs onto the patient. So she was her own self-limiting factor, and she'll say this openly, and we all have been this to ourselves, I think. But she would use pre-framing verbiage when she was talking about PerioProtect, like it's expensive, or it's $1,100, and she would make it like this thing before she knew if it was a thing for the patient. So she would create a barrier before the patient even communicated that money would be a barrier. And she made an assumption about what the patient can and can't afford, or does and doesn't value, before the patient was educated and had all the information to make a decision. So in our meeting, we talked about that and kind of where that belief came from. And she said, it's my feelings and my beliefs about selling. And we kind of went back to Ashley's why, her why for doing hygiene and her why for selling PerioProtect or enrolling patients in PerioProtect is because she wants the best for them. She does. That's why she went to hygiene school. She wants to take the very best care of patients. She believes in what she's doing. She's read the science. She knows the shit. Like, she knows everything from start to finish clinically. She's brilliant, you know, and she was her own self-limitation. Like, she was just limiting herself. So we made an affirming statement, you know, where I said, okay, well, these are all like the lies in what you're believing about selling and Perio Protect and all this stuff. These are all the lies. Do you agree? Are these the lies that you're believing? Yes. And then she came up with her own like self-affirming verbiage. Like, I am a great provider. You know, I'm here to take the very best care of my patients. When I talk to them about Perio Protect, it's because I want what's best for them. And for her, that was like an aha moment. And her numbers in Perio Protect did end up changing and went through the roof because she remembered why. You know, she went back to the foundation, remembered why she's doing what she's doing. She was motivated. She knew that her affirming statement was true, you know, and the things that she was believing about numbers and money were false. And they're just projections of her own beliefs about those things. So I think that was a huge aha moment for her. And I think that happens for I've seen that happen.
I want to add to that, because that's not just a hygiene thing.
Right.
So there's a lot of dentists out there. First of all, if you provide me with less quality treatment because you see I'm wearing a t-shirt, or maybe, you know, you're judging me that I can't afford something. I'm sorry?
A hoodie,
whatever. You know, dentistry is a lot like a roof repair, for example. Like, there's a leaking roof that you could just shove some caulk in there, and then one day you're having Thanksgiving dinner 1, 2, 3, 5 years from now, and your whole fucking roof falls in on you. And not only that, but your Edna dies as well, because it wasn't taken care of properly. And you owe it. It is not about you, and it's not about Perio Protect, or if it's an MODBLF composite. You owe it to your patients. And my dad always like beat this into me. You owe them the best. You have to tell them the best. Let them tell you they don't want it. Because even if they don't have a lot of money, people that value their teeth will find the money. And it's, people feel what you believe. And if you really believe, whether it's Perio Protect SRP, or, you know, or a crown, or doing something right for a patient, if you have that in your head and you feel like that sweaty back before you present it, you've got to resolve that, because you're making it about yourself. And if you've gotten to healthcare, it ain't about you. It's about serving people. And once you get that through your head, that this is not about you, I have to offer my patients the best, and let them decide what they value. I know a lot of very, very wealthy people that drive Bentleys, and they have terrible teeth. Just like I have enough money that I could buy a lot of things that I want. But
was that a flex? Was that a humble flex?
It was a humble flex.
Okay. I have money. I could buy things too.
Stop interrupting me. So #flex. So I went to Home Depot the other day because I needed like an automatic compressor to fill up my bike tires. There's a compressor for $550. There's a compressor for $59. I have the money to buy a fancy compressor, but I don't really value compressors. I figure I'll own that compressor. If it doesn't pump up the beach toys, I'll throw it away. Some people feel that way about their teeth. And some people, you buy them a house plant, and 6 weeks later, the house plant is dead. Not everybody's a candidate to own a house plant. Not everybody's a candidate to own their teeth. And I really believe that. And you don't ever want to value what they think. Because I've had construction workers that made very little money that had immaculate teeth. And I've had people in Bentleys that don't. And I think this is important.
So don't judge a book by its cover. Okay, my turn.
No,
my turn.
It's not about that, dude.
Don't judge a book by its cover, everybody. Give the best.
I am going to screenshot what you put in
You better not.
Look in the chat right now.
You better
look at
not.
what he's put in there.
All right, so y'all,
not only taunting me verbally right now, but in our chat, he's making comments that I love him too much to tell you what they are, but you would lose a lot of respect in half our audience for what
whatever. Hey, so listen, Brittany,
am I right, girls?
Something that you said, you know, the selling, and we've addressed that copiously here because, right, dentists, I know dentists who get physically upset when you say, I'm not selling, stop saying selling.
Oh yeah.
Right. I'm educating and right. And so we've gone beyond that. And look, we don't mean selling and you guys don't either, any form of manipulation or doing something that benefits you. You're selling because you know what lies on the other side for the impact of the patient, right? So you're quote unquote selling because you feel passionately about getting them becoming the guide and them being the hero in the story. And so that's what you're selling the story. You're not selling it from a financial. What?
Do you know how much money the government spends to sell people to not text and drive? Do you know how much money the government spends to sell people to stop smoking or wear your seatbelt?
Selling's also criminalized It's a criminalized word though, because selling, it's an exchanging of like services, kind of like it can almost be like bartering.
Well, like, look, it's almost like one person, the connotation is one person won and one person lost scenario, right? And that's not the case when you use that term. Exactly. Okay.
Yeah, it's just not a bad word, but I think that we've made it a bad word. We made it this taboo thing, but it's not. Like, I am proud to say all along that we sell well-being. Like, I want my patients to say yes to the treatment.
I was just having sweaty back for a second, and I wanted to, in case we had some new listeners on the scene, that they were like, wait a second. What is this selling you speak of? We're dentists. We don't say that.
No, and
unclick, bad review.
Unsubscribe, a bad review.
You do have P&L, you do have to keep the lights on, you do have to keep the doors open, but all of that will happen if you have like all this culture stuff.
Yeah, but you can do well in life by doing good.
It will follow naturally, so.
Yeah, 100%. But there are a lot of people that would get freaked out about that stuff.
So two things that you guys both exhibit, and I can speak because I know this because Craig and I talk about it, is that you exhibit an owner, even though you're not owners of the practice, quote unquote, right? That you guys exhibit an ownership mentality. Charissa, how did you get that? I mean, was that something, did you have that at your previous practice is where I'm going?
I did not. And okay. I think if I'm being honest, and this is not just to make you feel good, but I think you were a big part of that because you gave me the respect and the autonomy to do what I needed to do. And that becomes very empowering. And you realize, because let's be honest, I know that you've heard me say this before, and it's really, really true. When I was looking for another practice to hire me one day, when I looked at the website at Atlanta Dental Spa, I literally said to my husband, I could never work there. That looks way too nice. I'm not good enough for that. And that's where I was when I started there. So it was a little culture shock to me at the beginning. And I almost felt like I was faking it when I was there. I was like, it's one of those fake it till you make it things. But the longer I was there and the more I was empowered and encouraged and given the tools and the respect, the more I grew into that and realized, gosh, this really feels good. Like I'm really taking care of my patients. And now I do have an owner mentality, a protect this house mentality, not only because I am appreciative of what's been bestowed on me, but also because of what I get to do for my patients. I don't have just an owner mentality for the practice itself, but for my patients and what I'm doing for them. And I know I can't do that without standing in Atlanta Dental Spa. So to me, I want to do everything I can to make the practice as successful and functional and healthy as possible so that we can keep getting patients healthy.
Yep. Brittany, what about you?
So for me, a lot of it is exactly what Charissa just said. And going back to talking about, just feedback from the doctors and being, reinforcing the work that we're doing. For me too, I think that the way that we are compensated, Charissa and I are compensated based on commission, so it ties what we do every day to what we take home in our paychecks. So that just means that we're willing to work smarter, not harder, to find the best way to do things.
A percentage of your collections, right?
Yeah, percentage of collections.
Yeah.
Exactly.
That sounds a little more friendly than commissions.
So it's like immediate, it's kind of immediate gratification. It's just gratification. It's like you're getting paid exactly the amount for the work that you do, but also like Dr. Craig mentioned earlier, because I'm compensated according to the exact work that I do, I am willing to come in on a day off and see a specific patient. And that takes the very best care of them, the very best care of the team, the very best care of the practice, the very best care of me at the end of the day, and everyone gets what they want. It's that triple win. And, being on commission based too, I think helps people to gain an ownership mentality in the sense that they're willing to take on a role of like ownership over the department and over operations and over big picture things, because I know that at the end of the day, it'll benefit everyone and that I will also benefit from it later on. So for instance, like when I took the time and updated our standard operating procedures, or I took the time and created, quarterly reviews or whatever, like I knew that these things would like help our department like regulate basically, or when I took the time to onboard things, or me and the hygienist took time to onboard perio protect or salivary testing or whatever, like I know that that's going to be what's best for the patient. That's what interests me initially. And that's what interests Charissa initially. I know it's going to be good for the team, the practice. We're, on top of the latest technology, we're providing the very best care. And at the end of the day, it's going to pay off for me too.
Look, I mean, that just goes back to, something that we talk about, like relationships are unsustainable if only one person is winning continuously, right? So if you're working your ass off and the practice is the only recipient of that hard work, then eventually it's an unsustainable, right? It doesn't work. So we talk about it in our world as kind of a triple win. Like the practice has to win, the owner has to win, owners have to win, and then the team member has to win. Who's taking, but it's not just a me scenario. So like you said, there's you leaning into the whole environment lifts you up vicariously as well. So the business is doing better. So you guys have your lunches and you have your bonuses, and right. And everyone's leaning in, and literally, and that's the definition of teamwork. And I see so many people saying, oh, we're a team. And then you peel back one layer and it's a shit show, and it's chaos, and it's everyone, and it's a me, it's a everyone out for themselves scenario. But we say like, oh, we're a team. And then you like I said, it's inauthentic. So true teamwork is doing something to make the entire boat, like Craig, like you were typing in the chat, that
a rising tide floats all ships.
There you go.
But I think it's the first person that's got to win in any business in the dental business is the patient. And I've had team members many times say, we can't have this person here. We can't have this doctor here. I'm worried about what they're doing. So there's such, like, if we think about, like, I just had an experience of the other day, my buddy Randy and Johanna. Randy had a surgical procedure, and every couple of days he had a tough time. Jojo's like, did you call your buddy Randy? Did you call Randy? Did you call Randy? So compensation drives behavior, and I get that. But Brittany was not on any type of additional compensation beyond her hourly rate when she came to join us. It was her as a person, and we get to know our people. We don't just say, oh yeah, be an entrepreneur, come over here. We got to get to know you and understand who you are. And you can't work in our office unless you're at like the MBA level.
Yeah, no, the integrity and the values have to match up first. Like that's what the foundation is. That's first, no matter what. Ethical care.
And it takes a long time. It takes time, by the way, to get to that point. So if anybody's hearing this, you got, young dentists who just graduated and you're thinking about a hygienist, bring them on, get to know them first. We're talking about, a 10-step relationship. And the compensation portion of the relationship is steps 7, 8, 9.
Right.
Yeah.
Gotta go through steps 1 through 6. You gotta get on the same page. So I
want to make sure I clarify something, because I'm having sweaty back in my own skin. The triple win is, like Craig, you nailed it, is the patient, the team member, and then the practice, right? So if all three of those units are winning, then it's a sustainable thing, and you're doing good work, and everybody's
because
winning.
If the patient doesn't win, they'll feel it.
It's a mood.
They'll be pissed, and they'll be really upset.
And it's not sustainable. And it's not sustainable. I feel like honestly, this topic is like taboo. Like talking about compensation, talking about collections, talking about.
I'm tired of it. Quite honestly. Can we move
honestly, on? Though, it's like you have to think about everything, like the triple win and keeping the lights on and all this stuff. It just shouldn't be a bad conversation. It's not, especially when we're talking providing the very best care, being ethical providers, like doing what we love to do, and then income and profitability being the side effect of that, which is how it should be. That's sustainable, that's passionate practice. That's why we are driven to like keep learning and doing our very best, but it does start with the patient and what's best for them. And then it kind of like trickles down from there.
Okay. Brittany, if you knew a hygienist was struggling out there listening to this, and they're hearing what you're saying, and they're a hygienist, and they're literally feeling unfulfilled, and they feel like they're just, it's literally wake up and do the same thing, Groundhog Day, scraping teeth, go home, and they're feeling unfulfilled, and they don't love hygiene anymore. What's the one thing you would tell them? And Charissa, you can get ready for this answer too. What's the one thing you would say? Go do this,
go reflect on why you got in this in the first place.
Okay. What if that was, well, it was a good job, and it was, and I liked what it was going to provide from an income standpoint. What if it wasn't this deep why that you have, like, I want to help people? I'm just playing devil's advocate.
Then I would say reflect on the moment that you fell in love. If you're noticing that you don't love it anymore, then there had to be a point when you did. Point in time when you're passionate about it, and a point in time when you did. So maybe reflect on the point, like Charissa was mentioning, which came to Atlanta Dental Spa, or like I was mentioning, when we had those like switches, the switch, the aha moment or whatever. What was it that lit that passion at that moment in time, reflect on that and revisit it, because it's like being in a long-term relationship. Like you kind of have to remind yourself what made you fall in love with that person, or, you know, why you're still in it kind of thing, and just reignite your passion. So I think sometimes reflecting on that, writing it down is really helpful. For me, it's really helpful to reflect and journal and just say like, I remember when I got in these were my feelings, these were my thoughts, these were my goals, these were my dreams, this is my why, this is in my heart why I'm doing this. And then kind of get back to the basics of that, you know, kind of like look at what was it that made me refreshed or made me excited. I need more of that, you know, and be intentional about getting more of that, whatever it is, whether it's mentorship or CE, like the AOSH thing, whether it's, you know, considering, do I need partnership in some way? Do I need collaboration with someone? Do I need to listen to Bulletproof Hygiene? You know, no matter what it is.
Cool. That's a good answer.
But I would say go back to the drawing board.
Back to the drawing board. Like it. All right, Charissa.
Well, of course, Brittany stole my answer because we share a brain, and seriously, no joke. Like just starting off the new year, I am currently meeting with our hygienists at Atlanta Dental Spa individually, and I asked them all to answer 5 questions for me. And the number 1 was, tell me your why. Why do you do? What gets you out of bed in the morning? Why are you doing this every day?
What are some of the other ones? Out of curiosity.
Loving to take care of their patients, connecting with their patients, being able to support their family. Those were the resounding ones, really, you know, connecting with patients and taking care of them. And I think that's most hygienists wise. So since Brittany stole my answer, I would say second to that is, you know, this is life where things kind of get boring and get stale. So my question would be, what have you done new lately? What have you learned new lately? If there's been nothing new, get out there and look around. There's a lot of really cool stuff out there right now, outside of just scraping teeth, obviously. So, you know, look around for something new. And, you know, of course, I'm going to plug Brittany and I, because we're throwing a lot of really new ideas out there. But if you haven't done anything lately out of the box, look around to see what's out there.
Are you guys, obviously you guys are launching a podcast. Will you be going over more something clinical, or, I mean, will you be going over some of these things?
Yes, absolutely. Yes.
all of the above. Yes.
What about the book?
What about the book?
Do you have, I mean, is it more clinical? Like Craig and my book was not very clinical at all, because there were so many, you know, I have a bookshelf full of clinical books, right? But there wasn't any that we felt like the messaging was different. So what does your book consist of?
It is foundational from a team aspect, like how to construct the entire team, how to enhance culture, how to have a vision, how to reach your goals, set goals, how to implement kind of, oh my God, what's the word I'm looking for? Someone keeps you accountability. Also clinical. Yeah, we go through lots of clinical stuff. Charissa's like the guru on all things clinical. She put, you know, her 24 years of hygiene brain and knowledge in there. So it's everything from A to Z. And then like we mentioned earlier, if you want like a deeper dive or someone wants more meticulous information or specific information, the videos are where you got to go for that.
And of course, we talk a lot about, you know, verbiage and how to enroll patients, and, you know, educating to understanding, you know, looking at where productivity really comes from in the hygiene chair, really breaking that down and giving some really good solid how-tos and all of that.
You know, I beat on that drum a ton on the podcast, y'all, from a dentist perspective. You know, Craig was gifted with that from you were just gifted from birth, kind of being able to talk to people and being gregarious and enrolling people and people liking you. But I think that I say that I had to learn it more from an enrollment standpoint and be the verbiage, you know, I had to really be almost scripted in the beginning, because I would kind of I felt like I shit the bed. I'd go in there and be like, well, what was I even talking about that? I started talking about gross debridements and crowns and malocclusion, and people didn't, you know, I felt disconnected. And so I think it takes a lot of practice is where I'm going. And Charissa, I would say, and you guys would say, that I want to hear if this statement is true, that the most successful hygienists that you see are really great at communication.
Absolutely.
Okay.
The most successful people on the planet are good at communication. The quality of communication predicates the quality of your life. Everything's relationships.
Yeah.
I had one of our doctors, Dr. Myra, the other day, had a little bit of a thing communicating with the patient, and the patient just wanted to be, you know, wasn't Myra was looking to like fix the situation. All the patient wanted to do was be heard.
Right.
And the patient was getting really, really upset. She's like, I'm trying to fix him. I'm like, no. She just wants she just wants your presence. And she had her presence, and she like had the most emotional breakthrough of like, turn this patient who was really, really upset to really, really happy and did nothing. So communication is key.
I would argue too that we always focus on, let me go learn the Perio Pro, let me go learn Perio Protect, let me go do this. And we forget about the fact that like, that is to me, that's always almost, even in dentistry, Craig, the lowest hanging fruit for us to do more, make better impact with people is to learn the art of that communication, right? Learn the art of delivery, learn the art of patient benefited verbiage, learn body language,
learn how to read your patient.
Learn how to read your patient, right? Because they're uncomfortable more than likely in that chair, but you need to pick up on that. If you steamroll them, no one wins, right? They definitely don't win from that because they clam up. So, and I think we gloss over that in our education and even our postgraduate education. I think we just say, yeah, let me go do this implant course or whatever. And,
we default to the mechanics. We always default to the mechanics.
Well, of course.
We're scientists and we default to mechanics, and it's the art. The art is where the people show their mastery in the art of things. And I think also there's a lot of relationships that go stale, both in your personal life and your work life. People get stuck in habits, and there's no better way to re-energize what you're doing than taking some continuing education, revamping the way you do things. Mm-hmm. And there might be a dentist or hygienist that's listening to this, or maybe a team, God willing, it's a team, and they can all decide, let's start over, let's start new. I've done a lot of stuff, personal development stuff and coaching and stuff like that. I've taken my wife to things, and my wife and I have split apart like at an event, and halfway through it come back together like with like tears in her eyes, like, oh my God, this is going to be amazing. And it shifts our relationship and makes it better. So the beautiful thing, and this sounds like a perfect plug, but it just so happens the timing works out. July 9th is our Bulletproof Bulletproof Summit, and we're doing Bulletproof Hygiene. So imagine the beauty of having the hygienist go off. There's going to be a lot of common time where we're all like talking about like how to create the practice of your dreams and how to make it bulletproof. And then everybody goes off in their own silos. So office managers and team will go off in one area, hygienists will go off another, and the dentists come off in another. And those breakout sessions, we come back together, because a hygienist can go to the AOSH thing, a dentist can go to COIT, and you come back, everybody's fucking fired up on Monday. And guess what? By Thursday, same crap. If you want to make massive changes in your way of life and the way you do things, it has to be immersive and together and holistic.
You have to create alignment. You have to create alignment. Yes.
And no one's doing that. Like there's great dental seminars. I'm not saying we're the only gig in town. And I'm sure there's decent hygiene stuff. I just don't know it. So I'm sorry for being disrespectful. I haven't seen anything in hygiene. I'm like, oh shit. So that's why I'm so excited about Bulletproof Hygiene. But when you combine it all together, that's where the power can be expressed. And that's what I'm so excited about that.
Yeah.
That's why we had to have Bulletproof Hygiene.
It really, I agree. It was out of necessity. We really saw that being a big problem in the industry. Craig, like you're saying, Craig, everyone comes fired. Everyone goes to their CE, comes fired up, and then the person on the receiving end is like, settle down. What are you talking about? I wasn't there. Right. And then all of a sudden, like you said, Greg,
by the way, it happens at Tony Robbins seminars. Mm-hmm. Like there's what the Date with Destiny is called Date with Divorce. So spouse goes off, goes to this immersive training, comes back, life's going to be amazing. Oh my God, I'm going to get in better shape. I'm going to take better care. I'm going to be a better husband, a better wife. And the spouse was like, what the hell's wrong with you? I want the old guy back, because we would rather have familiarity. Some of us, certainty.
And change is hard. Change is hard.
Change is hard. But if you change the team, that's cool as hell.
Yeah, that's growth.
Make the plug, but that's growth.
Can I touch on communication for a second?
Sure.
I'm just thinking I want to really encourage people who don't feel like because we started talking about just communication and how it's practiced and verbiage and all that stuff. Like, I feel like really people need to be reminded, and I know that I need to be reminded, that if you're not like a naturally gifted communicator too, that's something that can be learned. Mm-hmm. And they are like skills, because I don't feel that I'm naturally gifted like Dr. Craig is. Like, he has the gift of gab, and he can walk in and kind of like enroll someone immediately and be their best friend and, immediate rapport. And I know that some of that is practice, but it is kind of like a little bit of his automatic too. You know, he is naturally a little bit like that. And I'm a person who has to work at it more. I have to learn the verbiage behind the scenes, practice it for myself, you know, have repetition, and then make it my own kind of thing. Yeah.
Yep.
It has to be practiced and repetitive. And a lot of people, you know, don't love that either, because then they feel like, oh, it's scripted. No, it's you know what you're going to say, you know how you're going to handle the situation. You don't get into sticky situations as much, and you kind of know how to troubleshoot on the fly. You know, and I feel like the more you practice it and the more organized you are behind the scenes, like the more smoothly things go when you're there, and the more yeses you get, and the more, you know.
I used to record I agree with you, Brittany, because I feel like we're connecting right here, because I share that same introvertedness, like feeling a little awkward sometimes. I used to record myself, talk about sweaty back. I would record myself in consultations so that I could go back and like cringe about like, oh God, what did I say that for? Right. And it was hard. It was hard to do, but I knew it was that ultimately it was going to lead to that repetition, right? Building that muscle to get me out of that place. And it became really fun, actually. And then I saw the growth. I saw like, oh, no, don't do that again. You know, I only made that mistake once when I said, you know, Mrs. Jones, let's do a gross debridement or something, right? And she said, what did you say to me? Right?
You called me gross?
Did you just call me gross? My mouth gross? No, that's our term in dentistry for some reason.
You haven't been here in a while, so you're gross now. It's called gross debridement. So,
I would agree with you, Brittany. I think it's I think you can definitely learn. I think it's a repetition thing. And if you don't, and don't surrender to the fact that, you know, he's just lucky he was born with that, or she's just lucky she was born like that. I think that's definitely a skill you can augment and learn.
I think in dentistry, we have to learn that, like, especially as hygienists, our number one limitation is time.
Mm-hmm.
That is over and over and over. You hear like, I only have so much time, and now they want me to do this and this and this, and I only have an hour and I can't fit it all in. And so timing is a real deal for us. And so for me personally, anytime we implement something new, I think, okay, what is the best way? And I sit down and write out my verbiage in such a way that I know it's understandable. It makes sense quickly. I commit it to memory. I say it in the car. I look in the mirror and say it. And until I've totally got it, and I could say it in my sleep at this point, and it doesn't come off as robotic once you kind of make it your own. But now I've created even more space in my appointment, because I'm not having to engage my brain for something that I'm doing all day long. So
yeah, and you're not fatigued by it, meaning that, yes, because you've almost committed it to memory, and now it's part of your vernacular. Yes, and I agree with that. I think it doesn't get exhausting. Go ahead.
You know what I think what it really is, as a person who has, I guess, the gift of gab or whatever you guys were calling it, it takes a long time to believe in yourself as well. You know, the first time you say a lot of this, you're saying scripting, you're saying the words, you're saying practicing, but actually what you're practicing as well is integrity, saying, I have the power to help this person. Give me the influence to help them see my power. Mm-hmm. Give me the ability to convince them to know that in my heart, I want to do good for them. And that's what it really is. So when I'm presenting to a patient, I can't, you sell it, I instantly enroll, I can sell things. You cannot have me sell something I don't believe in. Yeah. When I bullshit, everybody knows it. If I don't like someone, I can't even fake it. Brittany knows it. If I have someone in my office that I don't like, it is written, I radiate, I don't like you.
Yeah, me too.
So it's just, I'm sorry?
I have that gift as well. Yes.
Yeah, so what it really is the reps of saying, I am well trained, I have power, help me, give me influence. I can influence you to make the right decision for yourself. And that's why I'm good at it, because I believe in it. If you ask me to sell something, like people, you know, we have business deals in dentistry I've had in the past, like, hey, we'd love to get your this or that, and you sell it. I'm like, I could never sell that. Like even when we had a supply house sponsor one of our summits, I'm like, we're going to put this on stage. I'm like, no, you're not. I'm like, I don't believe in that. The thing sucks, you know? So I think it's just that you have to just develop and like you said, Charissa, when you walked into ADS, you're like, I don't belong here. This is too nice. So a lot of that process that got you good was not the verbiage. It was a high deserve level. It was understanding, I deserve this. My patients deserve this. Because you can't sell something unless you care about yourself first. You have to care about yourself and then sell it to them. It's enroll them. I'm sorry.
It's the belief in the delivery, I think. I think it has to go hand in hand, you know, because if you're stumbling over your words and like don't know how to deliver what you believe or how to like put it out there, I think it needs to be practiced. Since we're talking about like verbiage and things that we practice to make our days run smoother, is this a good time to talk about those things, or should we not kind of get
Yeah.
into that today?
No, I mean, if you've definitely got some, I love a system. So if you're going to tell me a system, like, let's go.
5 easy steps.
If you can tell me 5 easy steps to,
So no, I just think that it's like so much of what happens when we're not working our clinical, 9 to 5 hygiene jobs is what makes Charissa and I successful. It's a lot of times what happens, like what Charissa talked about regarding mentality, like, doing not necessarily self-help, but surrounding yourself with people who are uplifting, who want to win together, who want to collaborate, who want to get smarter, whose egos are out of the way, who want to learn and grow and be vulnerable and look stupid to learn a new skill together. Like, I think that that's a really important thing, and that's about hiring the right people. So getting the right hiring processes is really important. That's a behind the scenes type of thing. That's so important, Another thing is having standardized expectations and making sure that everyone understands what the expectations are. So standard operating procedures, what people consider kind of the boring things, but that is like setting people up for success. When we updated our SOP, I saw people's performance like improve and increase, and they understood what was expected of them. And it feels good to be able to check that box. Feels good to know, like, I'm winning right now. I'm doing something right. Like, I have something to measure that without someone reinforcing my behavior. I have a way to measure.
Everyone wants to know how to score the touchdown, right?
Yeah.
Everyone wants to know which direction do you want me to go for a win? Which direction do I go for,
Yeah.
and I think so many times we don't lay that out as leaders of a practice or owners of a practice. We don't lay out the guardrails of like, this is what a win looks like for me. And this is what I don't want you to do.
Or we expect that other people know or can read our minds. And I just think that's setting each other up for failure in any relationship. And especially with people you have to work in a high stress environment or, fast paced environment with every single day. It's just setting everyone up for failure. So organizing and understanding your standard operating procedures. I think having hygiene meetings is a really important thing too. Hygiene meetings and talking about what's going well, what's not going well, brainstorming together, making sure that everyone's an active participant at those meetings. So if you bring an agenda item to the table, you speak about the agenda item, you come with a solution, we implement something, then it's old business, new business. We follow up on the solution and make sure that it's good, Right. Having team socials improves morale. That's one of those, it's not tangible, it's an intangible asset though, team morale is big. It's the unity and kind of like
it cultivates teamwork for sure. I would agree with you on that. Yes. Getting together outside of a work environment. And I know that's like, we can't do that anymore. But
I think that predicates all of it. You no matter how much systems and protocols and business you have, if you have caustic culture, it will eat you alive. It's the cancer. It takes everything out.
Yeah, absolutely. And if your culture isn't very specifically kind of working against toxic behaviors too, I think that can grow like a weed, just like insurance, like as Charissa would say, like gossip spreads like wildfire. So making sure you have the culture where we don't gossip, we have sweaty back conversations instead.
Well, that's that protect your house part, right? Yeah. You enjoy your culture, you enjoy your office. A bad apple can sour the bunch. And so,
by the way, I'm reading the book Extreme Ownership, and one thing that's like resonated with me is it's not owning the failures, but owning if you don't take out a bad player and you tolerate low performance, that becomes your new standard. And that's something I've been, I can see like when I retrace my steps, I haven't been as quick to act because I like really bond with people and I like people. And if you're caustic and you tolerate them, you're really shafting your team. It's not about you, you're shafting your team and your results. So that book was real. That part of that book really resonated, tolerating poor performers.
If you look at that though, it's usually not about performance like clinical performance. It's usually about lack of integrity, not aligned values, issues like personally that a person isn't willing to like face and resolve. I feel like a lot of times that's like the foundation of the issue.
Usually they're great performers. The problem is they're high performer. Like in my my blind spot is you're a high performer and you're causing drama. That's where that's my sucker punch that I don't see coming.
That's
like you're making a lot of money.
It's hard to measure the damage or the effect that person is having. All you can see is their numbers, and that's measurable. So if someone's a high performer and they're producing a lot, but they're
doing the right thing to
members, or they're a poor communicator, that's damaging to the team. It's hard to measure that though,
Right, but I don't look at it as high numbers as much as like doing great work for the patient, but wrecking everybody else. That's the blind spot for me. And I think that's a good lesson for protecting the house.
Brittany and Charissa, I really feel strongly about what I'm about to say, that you guys are going to to change the direction of hygiene for the better, at whatever scale that happens. I don't know, but you're going to change that. And you're going to be part of this new movement, because I believe hygiene is, the MVP of dentistry. Dentists, I'm not saying that dentists aren't the MVP, but definitely hygiene is a massive part to getting people healthy and better and helping the dentist be better and all those things. One thing I wanted to say is, let's just talk about some of the if someone's interested in hearing more, if let's say a dentist is listening along and they want their hygienist to start, following you guys or ascribing to what you're talking about, or they liked what you guys said, let's go from the top level. So I know you guys have a very active social Instagram right now. And it's Craig and I talk about on the podcast how you guys in 9 seconds eclipsed our following, which
no.
was quite the gut punch.
It was like 10 seconds.
And it was pretty fast. So I wondered where you bought all those followers, Brittany. I'm just kidding.
Yeah, I'll give you the number.
You're right. But no, you guys have an amazing Instagram presence. So I would say that would be step one. And I'm guessing you're going to be announcing things kind of from the platform. Obviously, we talked about the Bulletproof Summit. You guys are launching a podcast. You've got a busy year. You're launching a podcast. This was your inaugural. Craig, help me out.
Inaugural.
Thank you.
Inaugural.
Anemone.
Inaugural.
Anemone.
No. It's not that. It's your inaugural.
See, Brittany,
let's give Tara an article for that.
All right. So you've got the podcast, the summit, the book, and one more thing. The course, right?
Yes.
Yeah.
You guys spent like 9 days in like creating a hygiene course that is definitely full of clinical acumen and all the things that I think you guys both mentioned. So that's going to be cool as well. Anything I missed that we can direct people to keep in touch with you or follow along with you in your journey?
Yeah, definitely Instagram is going to be the easiest one. We do make a lot of announcements on Instagram as to upcoming events, books, anything that's going on in our world. We'll keep everyone up to date, but also we are launching Mighty Networks as well. Is that something that we want you to touch on? Right?
Yeah, we can touch on it. I mean, we are just doing it right now. Literally, we sent out the email today, Brittany, for our network. So essentially what Brittany is saying is a Mighty Network is our closed. We have our own essentially closed communication network where it can push notifications to you, and it's a really cool experience from ours. So we just tell people to go to bulletproof.dental, and you can join our network and have amazing conversations about the content we talk about and collaborate with dentists all around the country. So we're building this out because we feel like we needed to have a forum for dentists to be collaborating on the topics that we talk about, right? And so sometimes Craig and I feel like we're just talking one direction to people, right? On a podcast, you feel like you're just spraying it out and then you're never hearing any feedback from what people are saying. And so this is the network we want to hear is then post this topic and let's talk about it a little bit. Let's get into some dialogue. If you disagree, agree, have anything to add, it'd be great. And so you guys have your own thing because we didn't want to put it, originally we actually set it up to be under the same umbrella as our Mighty Network. And then we said, you know what, this has enough. This needs to be a community all in itself because you guys have the chops, number one. And I think hygiene needs to have not being just commingled with a bunch of dentists. And likewise, right? Dentists want to kind of have their own discussions about, the struggles that we have. So you have your own Mighty Network. Where would someone go? I mean, that's probably not live yet. So I don't want to be premature in announcing that. Yeah. But when it is, how would someone find that, Brittany?
It would be the App Store, right? You go to the App Store, Mighty Network, and then search Bulletproof Hygiene.
Okay. All right.
Yeah, and then they'll have direct access. And like Dr. Boulden said, it's immediate. We'll be chatting and kind of getting a real life.
And in full disclosure, we are both growing that right now. So if you land on it, all of a sudden you're like, it only has 26 people in here on this network. Check back in a year. I promise you it'll look different.
Just give it a month.
Give it a month. Yeah, right.
Give it a month.
For them.
So it's exciting times. You guys have a big year ahead. I know you feel exhausted because of all the content you've been producing and all the prep you've been doing. And I can see the writing on the wall of the impact you're going to have and the hygienist you're going to help. And I'm just like, literally, it gives me goosebumps because I can see what's going to happen. Even in July, you guys are going to make massive strides and massive impact. So I'm excited for you guys. I'm your biggest cheerleader.
Aww. Thanks. We're ready for it. Let's do it.
We're ready. Charissa and I feel the same way. We can't wait. We're so excited to be here. We're so excited to be doing what we're doing.
Great. Craig, any closing sentiments?
No, I can't top that, guys. It was
Okay.
awesome to have you guys here. I'm excited about your future, and dentistry needs it. Dentistry as a whole needs it. If we do our jobs great, we're gonna help our community and help a lot of patients vicariously. I mean, we started this because we wanted to create impact on a patient by patient basis, and as you evolve and grow, you want to leverage what you've learned so that you can help more people, and that's exactly what we're doing. So I'm proud of it.
So this will probably be we're going to repurpose this. Will probably be your first podcast on your own channel. So if you're a hygienist that's tuning in and you want your dentist to hear it, obviously forward this. So alignment is key, just like we talked about at the summit. If you're a dentist that's listening to it on our channel, then obviously, get your hygienist to be connected with Brittany and Charissa on their new podcast and go support that for them. So that's great. Good stuff. Thanks, everybody. Had a great time, and let's all stay bulletproof.
Yep.
Good.
Indeed.
Thank
Thanks for having
you.
us.
Okay. All right. Good night, everybody.